Hey you guys, it's Dr. Kimberly Gartman, family practice physician and independent consultant with Arbonne. I'm here today to do our 5-Minute Friday. Today we're going to talk about something that I think is really important, particularly right now for us when we're having to practice social distancing because of the COVID-19 pandemic. And that topic is social isolation and loneliness, which is something that is very prevalent right now and can be a serious health issue for us. A couple of the reasons that it can happen, that we can struggle when we have to isolate ourselves or distance ourselves from people. One thing is autonomy. When we lose autonomy and the ability to choose, we can feel out of control, and it can cause increased stress and lead to lots of different issues with us. We also can have a loss of connectedness. You know, we are so blessed because we have technology like this. We can connect to each other via video and telephone, text, social media, but it's not the same as being in physical proximity with someone. It's not the same as having physical touch. And we all intuitively know this, but there's science to back that up. There are some significant health risks when you come to the point where you feel isolated and lonely. The American Psychological Association lists poor sleep, poor cardiovascular health. So it's not just emotional sequelae or problems, it's physical as well. So if you don't think that there's a mind-body connection, I challenge you to think again, because all the research and data that we're seeing on various things really connect the body and the mind. And let's face it, we are a whole being. We are a whole person, and it is all connected. So this isolation can lead to poor cardiovascular health. It also can cause a decrease in immunity, which is obviously the opposite of what we want to be happening right now. And so we definitely need to do some things to combat this social isolation and loneliness that we may feel. We can feel depression symptoms. We can have impairment in executive function. So that's ability to think on a higher level, perform job duties, make decisions, that type of thing. And then we can also see an increase in inflammation in our body. So more joint pain, more headaches, that affects your mood. It also affects your immune system and your cardiovascular health. So it's a big deal. We can see post-traumatic stress syndrome. We can see depression. The journal Lancet looked back just to see what quarantine and social isolation can do to people. And what they saw was an increase in fear, which is not surprising. We feel out of control. We don't know what's going to happen. We get afraid. We feel sadness. I think that's normal, and it's okay to feel sad. Our lives have been disrupted. We can numb or feel numb, like we just don't feel anything. Sometimes that's my default. I can just feel kind of numb. We can feel confusion and anger, increased stress and irritability, and even to the point of emotional exhaustion where we're just like, I can't cope with it. They also noted an increase in substance and alcohol abuse. And I am not you should never drink a glass of wine or another alcoholic beverage, but definitely we need to guard ourselves. We need to watch ourselves from some of that numbing activity that we can do because we can tend to mask other issues and end up in a substance abuse problem, which will just compound all of this in the end. What are factors that influence how well we cope? Well, what our current state of mental health is. If you already struggle with depression, anxiety, or other mental health issues, you may struggle more. And so that's not to cause you to be discouraged, but just to tell you to watch yourself a little more closely and get help when you need it. How people typically deal with stress will impact how well they cope. Their personality and resiliency, that grit, that sometimes people talk about. And there are ways to foster grit and resiliency. But also duration affects people's ability to cope. If you have an end date, it makes it easier, right? But we don't really have an end date with this. And so one of the things that I'm doing personally is I'm reminding myself that today I'm one day closer to being the end than I was yesterday. I'm one day closer to being back with my friends and going to restaurants and concerts. I'm one day closer. So that's a good way to kind of let your mind reassure you that we're one day closer. It's not going to last forever. We're going to be okay. Some other ways that we can cope better is to establish a routine. The first week we may have lived in our PJs if we couldn't go to work and we're all home. And I know not everybody is in that situation. I have to go to my clinic and it's just weird, and that's a whole nother thing. But if you're home, establish a routine. Get up, get ready, fix your hair, brush your teeth, schedule things throughout the day so that time doesn't just drift by. When we have a sense of purpose, we just do better. Be active, exercise, please, I beg of you. If you can get outside while maintaining that social distancing, please do that. Fresh air and exercise are critical for us, for mental health and physical health. Please do that. I cannot stress that enough. Combat boredom and frustration. So do things that stimulate you mentally. Don't just binge watch Netflix. And y'all, I'm not against Netflix. I think it's great. There are shows that I love to watch, but 20 hours of it is too much. We need to do puzzles. Take some time to meditate, to be mindful, to bring yourself back to center, to think about what you want to do or be in the next 5 years. If you're on track for that, or if your life is looking nothing like what you say your priorities are, what an excellent opportunity we have right now to slow down, to combat hurry sickness, to really take stock of our lives and assess where we are and where we want to be. That can be very powerful. Be sure you communicate. If we can't be in physical contact with people, at least we can communicate like this. We can be on FaceTime or Zoom or other things like that where we can see each other's face and actually have a conversation. I would encourage you to do that over texting as much as you can. Stay informed but not overwhelmed. So check in with the news once a day. Make sure you choose a trusted source, and then get off. That 24-hour news cycle is helpful to no person. It's not good for our brains to be bombarded with that negative news all the time. So get in, check what you need to know to be informed, and then get out. If you've got kiddos, be sure you talk to them, have a dialogue, let them know how you're feeling, validate their feelings, because they're probably feeling some of the same anxieties and concerns that you are. And then if you're we're all spiritual people in some form or fashion. But I would say to you, if you pray, connect with like-minded people, get in touch with your spirituality. And like for me as a believer, that's what I do. I talk to my friends who are also believers. We pray together. We share our concerns together. We support each other. And so that can be very, very powerful. And then lastly, remember why. Whether it's COVID-19 or because somebody you love is going through chemotherapy or has some other immunocompromised situation, remember why you're doing it. Remember the consequences of it and the power of it. When we have purpose, when we remember why we're doing something, it makes it easier to bear. It makes it easier for us to get by and to feel strong and empowered and good about what we're doing. So really remember why you're doing it. If you have pets, love on your pets. If you were thinking about getting a pet, that's something you might seriously consider. The AVMA quotes that scientific research shows that pets have a positive impact on our health and well-being. We know that. We see that with, dogs that go into hospitals and nursing homes and then, are used in other roles. And they also mention how the human-animal bond can play a role in helping to alleviate loneliness and social isolation. So pets can be very helpful to us in this time. And then lastly, I would just say to you, if you're really struggling with depression or anxiety, you just feel like you're so low, you're having thoughts of harming yourself, get help. It is available to you. If you don't feel comfortable being in person with someone, there's lots of virtual counseling available now. Also, physicians are using virtual medicine or telemedicine as it's known. I'm doing a lot of telemedicine. You can get medication if you need it. You can talk to a professional. So don't go without help. Don't let it get to the point where it's really bad. So while we have to be socially distant, I would say please continue that. Be responsible. Let's care about our neighbors. This is a time to let go of hate and division. It's a time when we can be restored to the America that we were. And what that is people that help each other, love each other, serve each other, listen to each other. This is an opportunity for that. So I hope that we will see the positive, and just remember that this will pass. And I would love to see us come out better on the other side than when we started. But if you need help, please get it. Know that I'm here for you. As a believer, I pray for you. If you watch this, I pray over you. And I pray that you will be well, both mentally and physically.